Peripheral nervous system. Introduction. The peripheral nervous system consists of several parts. The subdivision of the autonomic nervous system is the main focus of this discussion. Drug classes which are used to treat selected disease processes and illnesses affecting the autonomic nervous system, along with applicable patient education, are discussed. Here are your objectives, and these are your reading assignments. So let's review. Peripheral nervous system overview. As we recall, CNS or central nervous system contains the brain and the spinal cord. On the other hand, the peripheral nervous system or PNS contain all the nerves that lie outside of the brain and spinal cord. So this consists of the nerves that carry signals from the senses, eyes, ears, skin, etc. to the CNS, and from the CNS to the effectors or effector cells. The effectors or effector cells or tissue include the muscles and glands which produce an observable effect. Examples of this include when the muscle contracts to move the arm, or when a gland releases a hormone into the blood, as well as when the muscle squeezing the saliva squeezes saliva out of the salivary gland. Autonomic nervous system basically maintains the balance or homeostasis of the autonomic bodily function. The sympathetic nervous system and the parasympathetic nervous system are parts of the autonomic nervous system. Sympathetic nervous system basically is your adrenergic. They stimulate the sympathetic nervous system. So they are also called the adrenergic agonists or sympathomimetic. So they mimic the effect of the SNS neurotransmitters, norepinephrine, epinephrine, and dopamine. So these three neurotransmitters chemically classified as catecholamines, so they are substances that can produce a sympathomimetic response. This basically triggers the fight or flight response. The parasympathetic nervous system is actually the opposite of your sympathetic nervous system. So your parasympathetic nervous system or PSNS is your cholinergic or cholinergic agonist. So this is called parasympathomimetic. So they mimic the effect of acetylcholine, which is a neurotransmitter responsible for the transmission of nerve impulses of effector cells in the PSNS. So this triggers or stimulates the rest and digest response. So your sympathetic and parasympathetic nervous system affect the following. So involuntarily, it affects the smooth muscles of the cardiovascular system, the respiratory system, specifically the bronchi, the GI system or the GI tract, including your intestines, stomach, and so on, as well as the bladder and iris. So notice that this automatically contract on its own. So we don't have to consciously make our body contract those areas. They're all doing it on their own because they are basically autonomic functions. In addition, the sympathetic nervous system and parasympathetic nervous system helps regulate our endocrine and exocrine gland. That includes our adrenal, salivary, gastric, and sweat glands. So the reflexive action or function includes the control or changes in our heart rate, blood pressure, and as well as secretions and hormones. So this can actually go up or down depending on what's going on as a response to what's going on in our bodies or in our environment. The sympathetic nervous system or fight or flight or also known as adrenergic agonists. The stimulation of the sympathetic nervous system affects the following. So cardiovascular, it increases the heart rate. It causes vasoconstriction, therefore increasing the blood pressure. In our respiratory or pulmonary system, it causes bronchodilation. In the GI system, it decreases peristalsis or motility and decreases saliva production. In our liver, it increases glycogenolysis and gluconeogenesis, therefore resulting in increased glucose. So remember, glycogenolysis is the chemical breakdown of glycogen to make glucose. Gluconeogenesis is the formation of glucose from the stored glycogen. In the renal system, the sympathetic nervous system causes decreased urine output and causes urinary retention. In the eyes, it causes pupil dilation. So the way I try to remember this is whenever the sympathetic nervous system is stimulated, so the stimulation of the SNS causes the fight or flight response. So basically imagine yourself in a very dangerous situation. What does your body need to do? So obviously cardiovascular wise, you need to increase your heart rate, right? To pump more blood, vasoconstrict, to have more blood pressure, to produce more circulation in your vital organs. And in addition, it causes bronchodilation so you can take in more oxygen. GI-wise, because you don't need to digest anything at this time, it will slow down everything, therefore decreasing the peristalsis, the motility, and the salivary production. Now, the liver will cause glucogenolysis and gluconeogenesis because we need the glucose for energy. So we need that in order to respond to that emergency. And on the other hand, the renal, it will decrease the urine output because this is really not a good time to go to the bathroom, therefore causing urinary retention just in case we need that fluid down the road. And lastly, the eyes, it will cause pupil dilation in order to see better or to focus on the current situation. So adrenergic agonist agents, so they stimulate the sympathetic nervous system. So it produces the effects similar to the sympathetic nervous system. Side effects include tachycardia, palpitations, hypertension, anxiety, and tremor. Nursing considerations include assessment for therapeutic and side effects, as well as monitoring the heart rate, blood pressure, and cardiac rhythm. Very important patient education, especially depending on which medication we are talking about, is rescue versus control agents, and when it comes to Sudafed or pseudoephedrine, guidelines when it comes to the blood pressure, because again, as we recall from a previous unit, this can actually increase blood pressure, therefore can cause hypertension, and it can also affect the blood pressure medication response. So if somebody's already on a blood pressure medication, that can actually decrease the effect of that blood pressure medication. In addition, we need to educate them on how to use an EpiPen, especially if they have an allergic reaction, or especially in cases of severe respiratory distress or anaphylaxis. Examples of drugs under this class. So 1, adrenaline or epinephrine, or EpiPen or epinephrine. So the action of these drugs, as you may recall from previous units, is basically a non-selective alpha and beta adrenergic agonist. So when we say non-selective, right, it can affect both alpha and as well as beta 1 and beta 2. So this is usually indicated for cardiac arrest and bronchoconstriction. So this is a respiratory rescue agent, especially during anaphylaxis. In addition, it does have an effect on the blood pressure because of the effect on alpha and beta 1. So just a reminder, so when we're talking about the alpha 1 receptors, we're talking about the arteries or arterioles, so the vessels, right? So it can affect constriction or dilation of the vessels. Meanwhile, beta 1 refers to the effect in the heart, and beta 2 will have an effect on your respiratory system or your lungs. Next is your Proventil or albuterol and Zopenex or levalbuterol. So these are selective beta-2 adrenergic agonists. So what is it for? Well, these are your rescue inhalers. So these medications are short-acting bronchodilators, right? So these are your SABA, and they're used for rescue. Cerevant or salmeterol, these are your other selective beta-2 adrenergic agonists. That being said, a difference between this and your albuterol and levalbuterol, salmeterol is not a rescue inhaler. So salmeterol, it is a long-acting bronchodilator or a LABA, and this is used as a controller medication. So this will prevent bronchospasm, but it will not treat acute bronchospasms. This is not a rescue medication. Next is your Sudafed or pseudoephedrine. This is mainly used as a nasal decongestant, and it does that by causing vasoconstriction of the vessels. Other drugs that you may encounter down the road, especially during your later semesters that currently you may not need to know about, is your dobutamine and norepinephrine. So dobutamine and norepinephrine, you may see it in the presence of hypotension, so they may be used as vasopressors, and dobutamine specifically, this will be used as a positive inotrope. So remember, positive meaning increasing, inotrope meaning contraction. So it helps with cardiac contraction, and at the same time, it does help increase blood pressure. Norepinephrine is mainly for increasing of blood pressure. Well, now the adrenergic antagonist agents. So this will do the opposite of the agonist, right? So this will interrupt or block the stimulation of your sympathetic nervous system. So side effects include orthostatic hypotension and bradycardia. It will slow it down. Nursing considerations include assessment for therapeutic and side effects, monitoring heart rate and blood pressure, especially keeping an eye on decrease of heart rate and decrease in blood pressure. Patient education, it is very important to let our patients know to what? Monitor their heart rate and their blood pressure at home, and as well as being very careful with position changes, as this can cause orthostatic hypotension or low blood pressure with sudden change in position. Examples of drugs under this class include Cardura or doxazocin or Minipress or Prazosin. So again, these are medications that you've already encountered in the previous unit. So action, this is an alpha-1 blocker. So if we recall, alpha-1 affects the vessels. So this is often used for hypertension and urinary obstruction when it comes to benign prostatic hypertrophy. So again, these medications are used for hypertension and BPH. Lopressor or metoprolol, tenormin or atenolol, these are your beta adrenergic blockers or beta blockers. So the action is cardioselective beta adrenergic blockers. So the indications is for increased heart rate and blood pressure. So this help lower your heart rate and they lower your blood pressure. These are also used for migraine headaches. And so knowing that this can lower your heart rate and blood pressure, it is very important to assess our patient's blood pressure and heart rate before giving this drug. So generally speaking, we need to make sure that their heart rate is not less than 60. So whenever it's less than 60, the best thing is to hold it and notify the provider and clarify. Regitine or phentolamine, this is an alpha-1 blocker. So again, as you may recall, this medication is used as a reversal agent or a medication that we administer in case of a extravasation or infiltration of norepinephrine, phenylephrine, or any of those vasopressors. So again, the indication or when is this used is during an infiltration of potent vasoconstrictor drugs. This is a medication that we give in order to dilate the blood vessel rapidly in order to increase the blood flow in the area where the vasoconstrictor extravasated.